This injection kit contains betamethasone, which is used to treat a variety of conditions such as allergic disorders, arthritis, gout, blood diseases, breathing problems, certain cancers, eye diseases, intestinal disorders, and collagen and skin diseases. It is important to talk to your doctor about the risks and benefits of using betamethasone, especially if it is going to be injected near your spine, epidural. Rare but serious side effects may occur with epidural use. Betamethasone is a corticosteroid hormone, glucocorticoid, that works by decreasing your body's immune response to these diseases and reduces symptoms such as swelling. Make sure to follow your doctor's instructions carefully and take the recommended dosage at the optimal timing for the best results. Injections of this medication may be given into a muscle, a skin lesion, or a joint. These injections are typically administered by a trained healthcare professional, but if you are receiving intramuscular injections, your healthcare provider may teach you how to do it yourself. The location, schedule, dosage, and length of treatment will depend on your medical condition and how you respond to the medication. It's important to use this medication exactly as directed by your doctor to get the most benefit from it. Do not change your dose or use it for a longer time than prescribed. Always wash your hands before using this medication and check the product for any clumpy particles or discoloration before use. Clean the injection site with rubbing alcohol before each dose, and change the injection site each time to minimize injury under the skin. Be sure to shake the vial before use and inject the prescribed dose immediately after withdrawing it into the syringe to prevent settling of the medication. If you have been using this medication for a long time, do not suddenly stop it without your doctor's approval, as doing so may worsen certain conditions. If you have received an injection into a joint, be cautious about how much stress you put on that joint, even if it feels better. Finally, be sure to inform your doctor if your condition worsens or if you experience new symptoms. Some side effects of this medication may include redness or pain at the injection site, stomach upset, headache, dizziness, trouble sleeping, or weight gain. If any of these effects persist or worsen, consult your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. This medication may increase your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Additionally, this medication may cause your blood sugar to rise, potentially leading to diabetes. If you experience symptoms such as increased thirst or urination, it's important to notify your doctor right away. If you already have diabetes, be sure to monitor your blood sugar as directed and share the results with your doctor. It's also important to be aware that this medication may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infection. If you notice any signs of infection, such as a persistent sore throat, fever, or cough, be sure to inform your doctor. Seek medical attention immediately if you experience any serious side effects, such as weakness, unusual weight gain, thinning skin, bone pain, changes in menstrual periods, or mood changes like depression or agitation. Additionally, if you have received an injection into the joint and experience severe pain with swelling, weakness in the joint, or decreased range of motion, it's important to notify your doctor right away. In rare cases, a serious allergic reaction may occur. Seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so be sure to contact your doctor or pharmacist if you experience any other effects not mentioned here. Before using Readysharp Betamethasone 6 mg per milliliter injection kit glucocorticosteroids, it's important to talk to your doctor about any allergies you may have, as well as your medical history. This medication can make you feel dizzy, so it's important to avoid alcohol or marijuana while using it. Long-term use of this medication can make it harder for your body to respond to physical stress, so be sure to inform any healthcare providers if you will be undergoing surgery or emergency treatment. It's also important to be cautious around people who may have contagious infections, and to avoid contact with those who have recently received live vaccines. Pregnant women should only use this medication if absolutely necessary, and it's important to discuss the potential risks and benefits with a doctor. Additionally, it's unclear whether this medication passes into breast milk, so consult with a doctor before breastfeeding. Older adults may have an increased sensitivity to the side effects of this medication, and it may also slow down a child's growth if used for a long time, so regular checkups with a doctor are important in these cases. It's important to be aware of potential drug interactions with Readysharp Betamethasone 6 mg per milliliter injection kit glucocorticosteroids, as they can impact how your medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aldesleukin, mifepristone, and other drugs that can cause bleeding or bruising. If you are taking aspirin for heart attack or stroke prevention, continue taking it unless your doctor instructs you otherwise, as it can increase the risk of bleeding when used with this medication. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency medical assistance immediately. In the United States, you can contact your local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center for assistance. It's important not to share this medication with others. For adults, using this medication for a long time can increase the risk of bone loss, osteoporosis. Talk with your doctor about your risk and available treatments for osteoporosis. Lifestyle changes that promote healthy bones include doing weight-bearing exercise, quitting smoking, limiting alcohol, and eating well-balanced meals with enough calcium and vitamin D. You may also need to take calcium and vitamin D supplements. Encouraging children to exercise and eat a healthy diet can help prevent osteoporosis later in life. While using this medication, you may need to have lab and/or medical tests done, such as blood counts, blood glucose/mineral levels, blood pressure, bone density tests, height/weight measurements, eye exams, and X-rays. Make sure to keep all medical and lab appointments, and consult your doctor for more details. If you use this medication for longer periods, it's important to wear or carry identification stating that you are using it. Remember to take each dose of Readysharp Betamethasone 6 mg per milliliter injection kit glucocorticosteroids as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. It is important not to take a double dose to make up for a missed one. It's important to store this medication at room temperature, away from light and moisture. Make sure not to freeze it or store it in the bathroom. Keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.